Alrighty, thank you, Matt. It is time for our Health Watch. And as always, we are joined by our friend, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
Glad to have you here as we knock out this week's segment. So first up, we want to talk about little ones and their eyesight. The FDA just authorized the first eyeglass lenses to slow nearsightedness in kids who have that issue here in the U.S., right?
That's right. This is very promising, Symphony. So let's explain to viewers what's happening here. So let's start with the definition. Myopia, or nearsightedness, is basically when you're able to see things at a close distance clearly, but when you look at things that are farther away at a distance, your vision becomes blurred.
I have that problem.
Okay. So we'll talk more offline, but it may start in children, usually 6, 7, 8 years of age, and it actually progresses into adulthood, where if we don't put in corrective actions, treatment options early on, it can lead to further complications. So this is very promising. Other countries have had access to these lenses that just got approved. Clinical trial data indicates that the progression of myopia may go down by 71% over the course of 24 months, and that's very promising. Myopia may or may not be associated with another condition called astigmatism, which is basically either the lens or the cornea that has a distorted shape compared to normal, and that can also lead to blurred vision. So great news. If you do have, make sure, first of all, your children get that annual eye check through your pediatrician. If need be, the pediatrician may refer your child to either a pediatric ophthalmologist or an optometrist to make sure that everything's in order. But this is promising because it will prevent later complications from happening in adulthood related to vision loss, which is at the extreme, but glaucoma, retinal detachment, and things of that nature.
Yeah, very important stuff there. You have to value your eyesight.
Absolutely.
All right, now this next one kind of surprised me. There is a lesser known type of diabetes, so not just 1 and 2, but it's called type 5. So what is that and how is it affecting people?
Yeah, let's talk a little bit about this. So let's give an overview of diabetes in general. There are about 39 million Americans who have diabetes, right? And most of them have type 2. About 90 to 95% people living in this country have type 2. Type 1 is characterized usually by in early childhood where there's not enough insulin being produced, autoimmune disorder that requires insulin. Type 2 more associated with lifestyle factors, obesity, unhealthy options that we may partake in for a long period of time, which is characterized by insulin resistance. But type 5, though, not yet formally recognized by the World Health Organization or the American Diabetes Association, but there's a lot of ongoing discussion in the medical community, is malnutrition-related diabetes. So there's a certain criteria here. You need to have a low BMI. You need to be chronically malnourished for a period of time under the age of 30. What happens here is pancreas, with the organ in the body that produces insulin, actually reduces the amount of insulin being produced, which can lead to high sugars. So it can still be characterized by excessive thirst, hunger, things we see with diabetes in general that can lead to complications in your cardiovascular system, your kidneys, your eyes. So it's important that we, focus on this entity, especially in regions of the world where we see famine, for instance, or malnutrition in general, in parts of Asia, parts of Africa, because it needs a more tailored nutritional rehab plan in place.
Yes. All right, and we have one more as we, go ahead and make the switch in between seasons. Some folks may be dealing with seasonal affective disorder, but it turns out exposure to bright light can be helpful, right?
Absolutely, and this is now's the time. As we enter fall and then winter, eventually, this is the time. 1 in 20 adults in the U.S. can suffer from seasonal depression. Millions actually have a milder version known as winter blues. So if you know someone who's been through this, now is the time to wrap your arm around them, provide that extra support, and find out whether they would benefit from a modality like this. They need to speak to their provider. But bright light therapy, there's a lot of research on this, may actually be equivalent to medication. And it entails using a certain type of light. There's a specific type of light used early morning for 30 minutes or so, which can alleviate these symptoms to a great extent. So if you're feeling down, if you're sleeping a little more than usual, if you're craving pasta or sweet, you may want to speak to someone because you may benefit from some of this light therapy treatment that's available.
All right, good stuff to know. Thank you so much for joining us, Doc.